Welcome to the Martina Tierney Podcast. Before I get started, I would like you to do me a little favour. If you like this, would you please rate it, give it a nice rating, share it with your friends and subscribe, because that really does help, and it means that more people will get an insight into the wisdom and the guests that we have here on the Martina Tierney Podcast.
My research, I'm looking at what are the outcomes of therapeutic seating for people living with dementia.
It has to be that you make the product around the person, that you don't put the person in a chair and expect them to fit into it.
Exactly.
So the assessment process is so important.
Yeah, and taking that holistic approach.
Welcome to the Martina Tierney Podcast. I'm sitting here today with a very familiar face.
Thanks,
Hello,
Martina.
Kirsty. How are you?
Hi, Martina. It's nice to be back again.
Yes.
Thank you for having me back.
So those of you who are listening or who are watching, this is Kirsty, who has now got a new name. She got married. So Kirsty O'Connor is now Kirsty Ryan. Isn't that right?
That's right.
We had a lovely wedding last July.
Yeah, thank you for coming.
Down in Tipperary.
It was amazing to have you there to share the day with us. So
It's a lovely day. And you've got a really nice husband, I have to say.
Well, he was very impressed with you and the factory and all you've built as well. So
So I know he's been up and had a look around.
Yeah. You were very nice to show him around, to give him a personal tour of the factory. And he's just totally blown over by how fantastic this factory is. And he's a mechanic himself, so he wants to go back and implement some of the things that he's learned back at work himself.
Very good. So Kirsty, you've been with Seating Matters initially. You're here how many years now?
3.5 years now.
Oh my goodness.
Yeah,
gracious.
just coming up to 3.5 years.
So you'll be well known within the whole Seating Matters community, all the OTs that you've trained across the UK and Ireland and further afield.
Yes.
So we're moved now a little bit. We're still obviously Seating Matters, but we have created this new hub called A1 Momentum, which is a training hub for all the clinicians, to cover all training. And you're going to be part of the A1 Momentum. How do you feel about this?
It's
new development?
Really exciting that we have now taken on more clinical people within our clinical team, and we're able to expand that and grow and develop. And we're all able to learn off each other. We all have our different specialities and things that interest and we're passionate about individually. But collectively, we can bring them together and we can form this really expert clinical hub where we can disseminate that information to the seating specialists within Seating Matters, but also the wider audience. So we can give this information to people who are interested in seating, and we can include this in our seating assessments. We can help improve and develop those. For me personally, that's great. But then manual handling as well, we're able to disseminate this information within that realm as well.
So you're going to do some manual handling training, some proportionate care training, that sort of thing.
That is the plan. I mean, I've already completed a couple of courses with A1 Momentum. So I've already completed a couple of Train the Trainer courses and, oh my gosh, I can't remember the name of it now, but it's like an advanced
Train the Trainer type of course.
Yeah, and that's the plan, that we'll be able to provide these courses as well.
So mainly you will be providing these courses throughout Ireland. Is that the plan? Because we have other clinicians across the UK and further afield. So we're hoping that you'll be able to provide not just the seating training, but also the training for the manual handling and 24-hour posture as well. We're going to bring that in as well. This is something that we would like to grow and develop within A1 Momentum, and you will be the lead for that in Ireland, which is great.
Yes, there's so many exciting things to come because it all goes hand in hand.
Yes.
I mean, I love doing the seating assessments, and I'm very specialised in conducting seating assessments. But without the 24-hour postural approach, the seating assessment is just a part of the puzzle. You have to think about where the person is within their 24-hour day. So making sure that they have the supports in lying and sitting and standing. And manual handling is key when it comes to all those areas. Yeah. So we have to make sure that we're transferring and transporting the person appropriately, because that transfer then it's going to affect the position of the person when they get to the chair or they get to the bed. Yeah. So all goes hand in hand and it's all interlinked. So really exciting stuff to come.
That's true. And it's something that I have really wanted for a long, long time, because I always knew seating was very important, but it's only part of the picture. So that's really good. So for yourself, for self-development, like you started off with us, you were a mental health nurse, then you did your master's in occupational therapy. And the last time we were on the podcast, you had done your postgrad for seating, was
Yes, it was a postgrad in seating, posture and wheelchair mobility across
At
the life
Limerick.
course.
Limerick
in
University.
University of Limerick, that's right. I graduated 2 years ago now from that postgrad, and I've actually gone on to commence my PhD. So it's actually a professional doctor in healthcare practice. So I commenced that in September. So yeah, a couple of months now I'll be finished first year of that course. So
So the next time we sit down on a podcast, you will be Dr. Kirsty Ryan.
I don't know about that. That's in 4 years' time. So we might have an episode sooner than that, I hope.
Oh, very good. And how are you enjoying the PhD?
I thought that it wasn't going to be this intense. I mean, that's so naive, but it's actually really intense because the year that I started was last September. And that was the first year that the 6-year part-time doctor had been condensed to 4 years. So it went from 6 years to 4 years. They've condensed a 6-year course into 4 years to make it just that little bit more intense, I guess. But with a full-time job, with the travel that I'm doing, and then now the PhD work in the background, I've always got things to do. You know, it's very rarely that I'll have a weekend off, for example, but I'm really working on developing my time management skills and prioritizing time with my family, because we have to remember, you know, there's more to life than work, and we have to make sure that we're spending time with our loved ones and for self-care, them kind of things. But sorry, I went on a rant there.
No.
To go back to your question, I'm really enjoying the learning when it comes to the doctorate, because I have my project that I'm working on, my own research.
So what is your research? Just for those who maybe are only hearing from you for the first time, what is your PhD based on? What is your research?
My research, I'm looking at what are the outcomes of therapeutic sitting for people living with dementia. So that's my project. But also, while I'm doing my project, I've also got modules to complete as well. So it's mostly online, which is really handy for me when I'm part-time. And I have to do assignments as well as that. So there is quite a few pieces to it, but everything that I'm doing within those assignments and those modules, they're helping me with my project. Right, so it's all related. And I'm actually really enjoying the research side of things and working with supervisors. And
so you got 2 supervisors, is that right?
I do.
Are they from the university or are they outside the university?
Both of them are lecturers in UL. They're both doctors. One is an occupational therapist and one is a mental health nurse. So it's amazing that I have both of them. I'm really lucky to have both of them, to have those 2 perspectives from 2 different schools, 2 different disciplines, to get 2 completely different perspectives. However, they align and they agree with so many principles and things that I'm talking about.
Very good. So it sounds like you're really, really busy.
That's an understatement, Martina.
So with Seating Matters and now A1 Momentum, we are trying to keep you within the Ireland as opposed to having you flying so much across the UK and further afield.
Yeah.
And I know you enjoyed doing that, but we are getting more clinical staff in those areas so that you don't have so much travel, because travel is, in the lean world, travel is waste of time, isn't it?
It
really?
is very time consuming. Honestly, I do actually get a lot of my work done while I'm traveling, because you're spending time at airports and hotels and things. But it just makes sense when there's people already in the UK who are very skilled, very competent to deliver things like masterclasses or conferences. It just makes sense for them to do it.
Yeah.
And there really is such a gap in Ireland when it comes to things like trainings. So why not stay in Ireland, focus on Ireland and help the clinicians here?
And that's north and south of Ireland.
North and south. I mean, I can travel. I'm happy to travel, Martina. But Southern Ireland, I suppose, would be a main focus of mine.
So the other thing that you do a lot of in the south of Ireland in particular is seating assessments. In care homes mainly, is it?
Mostly care homes.
Mostly care homes, and also in association with our seating specialists as well. So tell us a little bit about that work.
Actually, that is probably where I'm the most busiest, is working, doing my seating assessments and helping seating specialists in Ireland. Because Advanced Seating, they're based in Cork, but they cover Munster, most of Leinster and most of Connacht. And they invite me to help them with delivering trainings. We regularly do trainings in hospitals and in care homes facilities. and also conducting independent seating assessments as well. And I think that's probably what I love doing the most.
The hands-on with the patient,
Yes, because that's where I can see the difference. You know, you can see straight away the difference in the impact that your work has on patients. I want to tell you about somebody that I saw probably 3 weeks ago. So I was asked to do a seating assessment with this lady. She's 102 in a care home, and she has a diagnosis of dementia. And the staff told me that she has a Sorrento chair, but she could no longer sit in the Sorrento chair. She was complaining of pain, discomfort, and they said she looked really uncomfortable in the chair.
How long had you this chair?
I think she had the chair a year. Don't quote me on that, but I think it was about a year, and it did meet her needs. But as her condition deteriorated, slowly it stopped meeting her needs, and staff stopped using it. So they said she'd been spending 6 months now in bed. And when I went to see her, she had advanced dementia, and she was curled into a ball in fetal position. So her legs were quite flexed, and her arms, and she was complaining of a lot of pain.
And was she spend most of her time in bed?
Yeah. She was in bed for probably 6 months because the staff knew sitting her in that Sorrento chair wasn't meeting her needs, and she was in pain and she's uncomfortable.
So was she spending most of her time in bed, Kirsty?
Yeah, she was. She'd spent probably about 6 months in bed before I saw her. So they weren't getting her out because they knew the Sorrento wasn't meeting her needs, and she looked uncomfortable and in pain. So when I first saw her, I had suspicions that this was likely Paratonia. So I assessed her by asking everyone to leave the room. So it was just one-on-one care. I closed the curtains. I turned off the TV. I provided lots of sensory information around her. So I put the blankets and the cushions quite close to her body so she could feel them. And then as I touched her leg, I could feel that it was flexed. But I just stopped her from flexing it further. And I was able to very slowly extend that knee. Now I could feel resistance, so I had to stop quite a lot. But once I felt that resistance, I'd stop, and then I'd slowly extend her leg a little bit more. So I knew it wasn't fixed. It wasn't non-correctable. There was movement there. So hence that led me to believe it was Paratonia. And it was just really fortunate because one of the seating specialists from Advanced Seating was with me. So he got to observe all of this. He hadn't seen this before. So it was a great learning for him that this is possible. And what we did with this lady was we managed to get a full body sling onto this lady. We hoisted her from the bed nice and slowly. We set up an Atlanta chair. So we reduced the seat depth and we opened up the back angle and tilted the chair down. So the whole chair tilted and opened. And we slowly hoisted her into the chair, and we used a 2-step hoisting technique with this lady. And I talk about this.
Just explain that.
I do. I talk about this in a blog, and it's on the CD Matters website. But basically what it is it's 2 steps. So the first step, when you hoist the lady off the bed and you come to the chair, you're firstly focusing on her legs. So you're making sure that her heels are clearing the seat of the chair. This will likely end up with her sitting kind of middle of the chair, not all the way back. And that's okay. The first step is just making sure her legs clear the chair. Then you allow her to relax. There will be a gap behind her, but that's okay. Just allow her to relax in the chair. Put a blanket over her. Let her feel comfortable. I think we probably sat there for 15 minutes in the dark, myself and the seating specialist. But I peeked under the blanket and you can just see her body tone reducing. Her legs start to relax. And that's what you're looking for. So stage 2 then. So after you wait some time and you see the body begin to relax, stage 2, you lift her again with the hoist. And the second time you're focusing on her back. So making sure you're getting those hips to the back of the chair. And we got the hips to the back of the chair. The heels cleared the legs because her muscle tone had reduced. And she sat perfectly in this chair for the first time in probably well over 6 months. It's probably closer to a year that this lady was not in pain because she was in pain 24 hours a day in bed and in chair. Now she's able to sit in the chair with no pain. And I could just see her body just relax.
So what were the main things that you did there to achieve that outcome? So what were the main things? So for anybody listening that are working with dementia patients, just take us through the steps that led to that outcome first.
The first step is assessing whether those body postures, whether they're correctable or non-correctable. Because if she has deteriorated and she has been left in that position for so long that now those postures are non-correctable, you're not going to get the outcome that we've just talked about. So you're going to have a different plan for that particular lady. But because this lady, I could assess her and I could assess that these were correctable because this was muscle tone, this was paratonia. That's the first step. The second step is using a holistic approach. So it starts from the minute you walk in the door. If you walk in the door and you're shouting or you're saying, "Good morning, Martina," and you're being very loud, and maybe you're opening the curtains or you're turning up the music or you're chatting with your co-workers, all of this is extra stimulus that will result in a higher muscle tone. If you start touching.
So the environment is so important.
Environment is key when you walk in the door. And a lot of people forget about that key part. The other bit is less hands-on. So the less touch that you can give yourself, the better. Because you will notice that when someone has paratonia and you go to move them or dress them or anything like that, you'll see that increase in muscle tone. So the more hands-off, the better. But the more proprioception, the better. You know, give the person that feeling that they're in contact.
And that's why you use the full sling.
Full sling is always good. I have seen in the past toileting slings. So getting the sling between the person's legs, and you will often find that there's a really high muscle tone there. And trying to force the legs apart is really painful for the person. So using a full body sling, and even if it is a little bit bigger than what they need, that will give more of a cocooning feeling. And another key part takeaway from that was the transfer method. Because, and I say it every time I talk to people, you really have to allow the time. And I talk to directors of nursing and I say, please put it into the care plan so that care staff have that time. Because if I rushed through that process, any stage of that process, I wasn't going to get the result. So you really do need to make sure that you give the care staff enough time to complete all of those stages.
And then your two-step lifting or the two-step transfer. Talk me through that again, just for people listening so they're aware of it. So the first step, you put her on almost halfway down the chair so that her heels cleared.
The first step, like you said, you make sure that the heels clear the chair because those legs are going to be flexed. The heels are most likely going to be back behind the knees. So clearing them heels, allowing her body to relax, put a blanket over her, play some nice music.
Does it have to be a weighted blanket?
No, it doesn't have to be. Just anything to give her that sensory information. And then once you see those legs begin to drop and start to relax, then you can move on to stage 2, which is you hoist just up enough that you're lifting the weight. You don't need to go very high or anything. But just
do
enough.
you keep I'm just being very specific here. Do you keep the loops intact on the hoist while you're doing step 1? You don't have to take the loops off. You just keep the...
It depends. I mean, oftentimes I will take them off so that I can allow the person to relax properly more. And maybe just taking the equipment away from the person so that they don't have so much in their face. However, removing and hooking up those loops, that can cause a certain amount of movement. So if the person is very, they have a real tendency to have that increased muscle tone on movement, you might want to just leave them on. Just depends.
So there's a couple of things there that come to mind. The first one, just explain for the people listening, what is paratonia? You've used that word a few times, and I know we know what it is, but for the benefit of people listening to this for the first time.
Paratonia is defined as an increase in muscle tone. So it's a form of hypertonia. And it's marked by involuntary resistance to passive movement.
So that's a key word, I think, for this. It's involuntary resistance to passive movement. So they're not being aggressive. They're not trying to fight against you. It's involuntary.
They can't control this.
No.
This is like a reflex. So it's involuntary resistance against passive movement. So by you moving the limbs or you helping them person to dress. And that can cause that high muscle tone.
Yeah.
But it's also dependent on the force that you use. So how forceful you are to do that passive activity, and also the speed. So how fast you move the limbs and help that person to dress or whatever the task is. So it's also interesting because not a lot of people have heard about paratonia, but it affects so many of the population.
I think they see it and we see it. We just didn't know that it was.
Didn't know what it was.
And that there was a way of managing it. And there's no way of curing it, but there's a way of managing it. Don't think we realise that.
Yeah, you can definitely reduce how bad it gets. So you can reduce the severity and maybe slow down the progression of it as well. But what I read was that 95 to 100% of people with late stage dementia will have paratonia.
Yeah.
And that's a huge amount of
so
people.
We really need to be educating people on this and the management of it. And I think it really emphasises the importance of not just the proper chair, but how you get the person into the chair, the manual handling, the moving of the person, the whole process of getting them into. It's not just about the chair.
No.
Because if it was just about the chair, the Sorrento probably would have worked. Like, number one, why did the Sorrento not work? Was she not assessed for it? Was it one? Why did the Sorrento not work? And why was the Atlanta chair so much better?
Well, the Sorrento, there's no doubt about it. It's a fantastic chair and it meets a lot of people's needs. But the thing about it is, when it comes to paratonia, that high muscle tone will likely cause flexion of the legs, flexion of the arms, the wrists. But with the flexion of the legs, you do need that negative angle on the leg rest. And yes, the Sorrento does have that negative angle, but sometimes it's just not enough. Sometimes you need to have a greater negative angle. And even with the Atlanta, sometimes it's not enough because there is that space under the Atlanta to accommodate the heels being back behind the knees. But sometimes I do need to use a thinner cushion. So I need to reduce the depth of the cushion so that you can get more of the legs under if there's more flexion.
Yeah.
But the tricky part really is when it comes to loading the feet, because that's always the hardest part, I think, of that whole assessment is making sure that person has their legs extended to the point that their feet are on the foot plate. Yeah. What will often happen is you are going to need a deeper foot plate, or not a deeper foot plate.
An increased height, or
you are going to have to increase the height of the foot plate, usually by using like foam, memory foam, cushioning or something like that to allow their feet to be loaded.
Yeah. So I think this all emphasises that it's not just one size fits all, that it's not always about the product, it's about the assessment process and being able to make the product suit the person, not the person suit the chair. And that's what we at Seating Matters always say.
Yes.
You know, it has to be that you make the product around the person, yet you don't put the person in a chair and expect them to fit into it.
Exactly.
So the assessment process is so important.
Yeah, and taking that holistic approach that happens as soon as you walk in the door. So making sure that you're setting the person up for success, that you're not increasing that muscle tone without even realising it and making the situation worse. And the chair really is a key piece of the puzzle, but at the end of the day, it's a piece of the puzzle. We need to think about bed positioning as well, because unless we incorporate that bed positioning, it's all going to go to waste because that person's probably spending 8 or 10 hours asleep in the bed at night time. So making sure that we're protecting their body shape in bed is just as important. Yeah,
yeah. So that's something like people listening to the podcast or watching, that's a message that we really want to get out there. Is it's about 24-hour care. It's about how you move the person. It's not just about the chair. It's not just about the bed and mattresses, which is the emphasis a lot of the time. It's about the whole approach and the whole 24-hour posture. So that's a message that we're quite adamant to get out there.
Yes. Yeah. And what I am learning is there is still so much to learn. You know, we're doing a lot of trainings and we're providing a lot of information, but there's still a lot of learning to be done. And that's a key reason why I'm doing my PhD research, is because we still don't know all the evidence around seating, and especially for people with dementia. So I'm really looking forward to being able to give more and more information as my research progresses. And obviously with Seating Matters' help, we'll be able to give that to a wide audience and increase practice and the quality of practice, good practice around the world.
You're doing a great job, Kirsty,
Thank
I have
you.
to say. Very proud to have you on board and on our team. It's absolutely wonderful. It's great to see and hear your passion, especially for dementia, because I know that is the one thing, obviously, that you're very passionate about. So tell us what else is happening in your life at the minute. Any other exciting things coming up soon in the future?
Well, it's funny that you mention it. Only today I got an email to say that I have been accepted to speak at the implementation conference at the University of Limerick, which is where I'm going to be presenting on my own research for the very first time.
What's an implementation conference?
It is a conference revolving around implementation science. So seating is an intervention, but this implementation science is how is that seating intervention, how is that implemented? So what are the barriers to people actually implementing seating? Or what are the facilitators, for example? So it's great that we have all these interventions, but there's also studies now out there about how we can improve implementation of interventions.
Very good. And who will your audience be at the conference?
It will be a mix. So we'll have a lot of PhD students, researchers, lecturers. I'm pretty sure they're going to be bringing in other associations and associates as well. So yeah, there'll be a good mix of variety of people at the conference, and I can't tell you how excited I am.
Congratulations.
Thank
on
you.
That. You're doing really well.
Thank you.
So you're going to keep busy speaking, training and doing assessments for the future. So what is your big ambition? Have you got, I know you've so much on, like obviously you want to get your PhD finished, but what would you like to see change?
What would I like to see? I would like to have some kind of standard that people who have dementia, that when they are admitted into care homes, facilities, even hospitals, that there's a protocol that clinicians must follow. So if somebody is admitted with a diagnosis of dementia, that they're saying, okay, well, this is the assessment for the chair. This is the bed positioning assessment. And these things have to be carried out. You know, it shouldn't just be ad hoc or depending on the clinician's knowledge or training. It should just be a standard everywhere, so that people receive the best quality care with evidence-based practice.
So we know the benefits to the patient. They're obvious. I mean, it's about reducing pressure injuries, reducing falls, providing comfort, all those things. We know all the benefits to the patients. What are the benefits to the care homes? If there's a care home manager or owner listening to this, look, what's the benefit to them of introducing the right equipment or the right protocols? There's
so many benefits. There's so many. And this is what I'm telling people when I go out there. You know, if your patients, if they have reduced instances of pressure injuries, of reduced instances of falls, that will lower the costs for your care home. That will lower the burden of care that your caregivers must be giving the patients. So it frees up their time so they can do other tasks. It's better to go into a work environment where your patients are happy. You know, your staff, your managers, if they go into their care home and they know they're doing the best for their patients and their patients are happy and comfortable and functional, it's about the best feeling.
And reduces the risks to staff of injuries as well.
And obviously reduces a lot of risks for the patients too.
So what I would really love to get on the podcast is a care home manager or a care home owner that is implementing some of these changes, that are using proper seating and these protocols, and get them on here to talk about it, to see how they feel it benefits. So maybe in the future that's something we could do, and you can help me with that, Kirsty, in the future.
Definitely, I'd definitely like to help you with that. I also actually was talking to a care home manager recently, and she was telling me that when their patients and their residents are sitting in a chair and they're sitting upright and they're engaging with the world around them, the families mention and the families report how well that they look. And they say, you know, how happy they are, and it makes them feel good. So there's also that benefit to the families as well.
Yeah. And benefit to the care home to see that they're providing the best care that you can, especially at that end stage of life, you know, in the last few weeks, months or years of their life. So, Kirsty, you're doing a great job.
Thank
you so much for all your passion, for all your hard work. and for your commitment to A1 Momentum, as we now want to be called, because I'd say that is the training umbrella for the whole organisation. So thank you so much, and look forward to working with you in the future.
Yes, I can't wait to come back again and tell you what I've been up to in the next one. Thank you.